Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we're bringing you key experts in the fields of nutrition, prevention, integrative and lifestyle medicine, and biochemistry and physiology for problems for the individual, society, and the whole. And today we have a guest, Dr. Akos Koller, MD, PhD, Doctor of Science. He's from the Cerebral Vascular and Neurocognitive Disorders Research Group, the Department of Morphology and Physiology, Institute of Translational Medicine at Semmelweis University in Hungary, Budapest. And he wrote an interesting article with his colleague, Dr. Szebeni, and it was entitled Multisystem Endothelial Inflammation, a Key Driver of Adverse Events Following mRNA-Containing COVID-19 Vaccines in Vaccine 2025. And so his background, and I'll let him share with you, as a specialist in the microvasculature. And what I want to find out from him is what causes these adverse events from the vaccine. And so welcome, Dr. Koller. Thanks for being on the show today.
Thank you very much for inviting me.
So talk to me a little bit about your background and your specialty and why this topic was of interest for you.
Yeah, my background is in microcirculation. These are very, very small vessels you cannot see with naked eyes. And but these vessels, support all the organs and tissues with oxygen, with nutrition, and then deliver the waste material. So it is very important that if the microcirculation is healthy, and especially in COVID or in any infections, because they can deliver, the immune system, they can clear up the tissues. So if it works well, usually we can get through on various inflammatory diseases or virus diseases. And I think as the COVID showed that many people get very sick or died because they were already sick. Their microcirculation was already affected by diabetes or hypertension. But those people who were relatively healthy, they could get through better on the COVID. And also, they had less post-COVID syndrome, less post-vaccination syndrome. So the healthy microcirculation is a very good base to go through the diseases.
So what causes the inflammation when you have COVID in the vascular system, and what causes inflammation when you get an mRNA vaccine? Are they the same thing, the spike protein, and are the spike proteins the same or different in the natural infection versus what is created by the mRNA technology?
Yeah, I think with the mRNA technology, there is three things I would mention, which is maybe different than from the virus. One is the liposome, the membrane package, which itself can elicit inflammation and adverse reactions. The other is the mRNA inside this liposome, which can get into the cell and then produce the spike protein inside the cell. And that's quite different than in the virus, when the virus is outside and the spike protein is outside. And also because the mRNA was modified, so it cannot be break down by various enzymes. So therefore it's there in the cell and keep producing the spike protein. And it's very difficult to control. And some people who are luckier, they can sooner or later break down the mRNA and the spike protein. Some people cannot. It's just like when somebody has a not healthy lifestyle, can get sick. Some people don't. So it's very individual. And so therefore, some people were affected very much so by the vaccine, the mRNA vaccine. Some people were not. And
So let me ask a question. So there have been other coronaviruses pre-pandemic, correct?
yes,
And they have
yes,
a spike protein,
yes.
and yet no harm to the vascular system. So then we have a natural infection from the COVID virus that came out of Wuhan or whatever happened there,
Yeah.
and that causes a problem. And then we have a spike protein that comes out of the vaccine. So there's got to be something different about what was in the COVID virus that came out of the Wuhan lab and what is created in the messenger through the messenger RNA
Virus.
technology, correct? And
Yes,
so would you say that the one that comes from the vaccine is more pathogenic, meaning it can cause more problems, or do you think the one from the virus can cause more problems?
no, I think that what's coming out from the mRNA is more pathogenic. And also, it's keep going on and producing and then get through the whole body and less localized. And as you said, there was coronavirus is with us in the last 50 years or so. It was well known also in pigs also was coronavirus. And also we went through, but this coronavirus was different, I think, which came out from Wuhan or wherever. And in the beginning, it was a very panic situation where there was a isolated, very serious condition or general, but it was a panic. So, the government, all government had to react, and they thought that this technique will gonna help and save lives, and I think it did. But some people get oversensitive to this spike protein, and they couldn't deal with it, and they got this so-called, adverse effect and post-vaccination syndrome. But especially in the second or third job, that's when they say. But
In the
because
second
of
or
that,
third vaccine, is that what you
yeah,
is that what you
the
mean?
second times or the third times you give the vaccine, it could lead to more adverse effects. But I think it was realized by now by many experts and by the Center of Disease Control and other agencies, and they rewrote the guidelines, and now they restrict the vaccine to older people and with multiple diseases, so they don't advise to give generally to everyone every time. So it has to be an individual decision on
So
patient
so
specific.
again, the spike protein is just part of the whole. So if you're making a vaccine, why would we pick out such a toxic agent to make a vaccine from? That confuses me.
Yeah, I'm not expert on vaccines, but there was many vaccines before, which was a dead virus or virus which was a little bit modified not to be virulent, and they used that. But for example, with the Sinopharm, it was shown that it does not elicit as much, immunoglobulin G level as the Pfizer Comirnaty. So therefore, I think it was the feeling that we want to have a good defense system and increase the level of immune system with that mRNA product, but it turned out to be that it also can cause side effect in some individual.
So how does this spike protein? I mean, the title of your article, is multi-system endothelial inflammation. So
Yes.
endothelium is the inner lining, that single layer in the inside of the artery. So how does the spike protein cause that? And then is it worse from, again, the infection or the vaccine? And then if it is causing problems, because to my understanding, we still don't know how long the messenger RNA created spike protein is going to last in the body. I mean, I've heard up to
Some people for years,
yes.
some
So
people for years, but not everybody. And that's we don't know. That's what we should know. Why somebody doesn't have this problem and few people does. And I think therefore we try to describe the mechanisms which could cause problem in order to see if it's different in one person than the other. Many people smoking and don't get lung cancer, and some people don't smoke and get lung cancer. So it's very complicated.
So could you give the basics of how the spike protein causes this endothelial inflammation? I mean,
Yeah,
simplified.
the spike protein somehow can degrade the glycocalyx, which is a very fine structure, um, um, carbohydrate and protein structure on the surface of an endothelium, which is very important because it keeps away the cellular elements like red blood cells, white blood cells to stick to the endothelium. So they're running inside the vessels, not at the edge. But when the glycocalyx break down, because of the spike protein is attached to the endothelial membrane, then the thrombocyte can attach, the leukocyte can attach, and then can start locally an inflammation, because then there is a enough concentration of the immune molecules and the thrombocyte and leukocyte, and then locally can induce inflammation. And because of the endothelium is like about a room size, I mean the surface like a 10 square meter or something like that in the whole body, it's a big surface. So therefore on that surface, it's like a battlefield where all the events takes care. So therefore, would be important to see how we can improve the endothelium and the endothelial surface and the glycocalyx. So then the spike protein doesn't attach to the membrane of the endothelium.
So there are products. So I work in a integrative medicine practice for 40 plus years, and there are actually in the last 5 or 6 years there are products that say they enhance the glycocalyx. And they're
Yes.
made, I believe they're made from seaweed or a type of derivative of an algae or something like that. So that would be something of benefit of protecting the inner lining. Do you have any ideas on how to get
To
rid of
protect.
like, for example, nattokinase has been used in Japan to break for vascular disease, and some people believe a cardiologist here, Dr. Peter McCullough, has come up with a concept of nattokinase and curcumin and bromelain and a few other compounds to break it down. But if we're stuck with it and we don't know how long it's going to be created and we can't turn it
Yes.
off,
Yes.
then
So some. Yeah,
do
I
you have
think
any ideas?
experiments should be done to see how you can break down the spike protein produced by the messenger RNA, and whether they can be used, in a clinical setting in a patient. With the glycocalyx, actually, we done some experiment when we put in a similar liposome a syndecan molecule, which is one of the basic elements of the glycocalyx, and that we use it in animal experiment to restore the glycocalyx, and therefore there was much less permeability and less edema development. So maybe there are some natural products which could be used just to restore the glycocalyx, and that would provide some defense against the spike protein attachment.
Yeah, I'm sure there's a few supplement companies who like what you just said.
Yes,
um, I know some. Um,
I hope they listen.
they will. They will. We have a cardiologist here at our clinic, and one of his favorite products is a product that stimulates the glycocalyx, or it's been said to
Mhm.
do that. And he uses it
Yeah.
all the time in vascular disease patients for that very
Yes.
reason.
Yes. Yes. Yes.
I've had it explained to me like it's kind of like a Teflon. It can't.
That's
The,
right. Or when
the
you go up on the escalator, you see that little hairy stuff, which
yeah.
prevent you to stuck there, your feet. So it's
Mhm.
it's a meshwork which very good. And so because you know the glycocalyx in every surface of the endothelium, therefore it's very important the healthy one. And if somebody has a diabetes, the glycocalysis break down. Therefore, there is more severe reactions with people with diabetes with the vaccine and also with the COVID, because the glycocalyx is already impaired. And with the heart, relating to the heart, in the heart, there is a very high density of the capillaries, which is only endothelial cells. 1:1 ratio cardiac muscle fiber, 1 and 1 capillary. So there's a lot of capillary, a lot of endothelium in the cardiac muscle. Therefore, if somebody has a diabetes or cardiomyopathy, then there is a much greater effect of the vaccine, because the glycocalyx is already not there. I mean, this is just one potential mechanisms.
So do you think? I mean, just in general, the vaccine in post-vaccine syndrome is kind of a more severe reaction than long haul COVID. In other words, long haul COVID has similar symptoms of fatigue and muscle weakness and cognitive decline, and vaccine injury can have severe. So I guess the question is, again, getting back to which spike protein is the baddest, so to speak.
Yeah.
But from a natural infection, even though it's been altered because it's not the same as the original coronavirus spike protein, it's not as bad as what happens in the vaccine, because there's all kinds of there's all kinds of anecdotal stories about even like clots forming in people who are morticians, and they're you know dealing with they find blood clots as they're treating the patient with embalming, and they see big clots.
Yeah.
So do you have any pharmaceutical concepts of breaking up? I mean, is it the clotting that's the issue, the hyperclotting, or just the inflammation that occurs from the
I
spike
think
protein?
that, some people tend to have the tendency to produce clotting, especially old people or people who are sitting too much, or if you fly. But I think in a general treatment post-vaccine syndrome, you can give blood thinners, which would, prevent the clot development. That would be, adjuvant, not, you treat the symptoms, you don't treat the disease itself. But that could be very useful, for example. And
So
also, as we mentioned, the glycocalyx you can attack, the fever, and so on, so on. But indeed, what else you can do? We did studies on post-COVID syndrome. Is that in a long COVID syndrome, that people who exercised, there was a much more improvement, much less development of the neurological, mental, or cardiovascular or other diseases. So the exercise is perhaps one of the best against the persistent fatigue or anxiety, which is present in the long COVID syndrome.
yeah, I know cardiologists that's very much into this, Dr. Peter McCullough. He encourages sweating.
Yeah,
Some of the athletes early on had problems, but all of it, they haven't had them in a while, and they got vaccinated. So maybe, um, you know, that's where the far infrared sauna's coming
yeah.
out. But sweating. Um, all right. So I'll ask you the same question. Are you going to get any more vaccines, messenger RNA vaccines for COVID?
I don't think so at the moment. I think that COVID is not as dangerous as it used to be. And also, I tell you that I never got sick, and everybody in the family either got the COVID disease, and I was with them all the time. So I don't get diseases for some reason, although I did a lot of sport, a lot of exercise when I was younger. That may help me. But it's very individual who would get it or not. And also in family, somebody get the Pfizer and still got the COVID. See,
Well,
so
many,
it's
many,
very,
many
very
people did.
individual depending. And usually I don't get this flu, I don't get diseases usually, but I'm
Is
just
there
lucky.
is there any way to measure? So, for example, I do IgG quantitative spike protein antibodies as an
Mhm.
indirect
Mhm.
measurement, and I can tell you just from observation that when you see vaccinated individuals, they have way higher levels than somebody who has post-COVID syndrome
Yes,
most of the time. Most of the time, not all the time, but most of the time.
I agree
And it
with that.
usually correlates with symptoms.
Mm.
I mean,
Yeah,
usually.
yeah.
So,
We had published a case report with Dr. Szebeni about a patient who was receiving chemotherapy. And then even there was a chemotherapy in response to the Pfizer BioNTech vaccine, it went up to 18,000, 19,000, unit, immunoglobulin G. And then when there was an um COVID infection, it went up only 10,000. So it was like half. So the natural infection resulted in 10,000, while the Pfizer vaccine resulted in a 20,000 IgG units,
yes,
immunoglobulin. So
we do. I do it through lab. I do it through LabCorp, and frequently I'll see people above 20,000, 25,000, but
yeah,
usually they've
can
had
be,
multiple vaccines. They've had
can be,
multiple vaccines.
that can be.
Um, so
So maybe that's
do you have
very strong response. This very strong response had side effect more than the natural. But some people died from COVID. So especially back then, the COVID virus was different than now, and it's mutated along the way, and maybe should be readjusted after half a year, and maybe give less or something, because then it became weaker and weaker, the virus.
Let me ask you this: since you're a vascular specialist, and you were, an athlete in the past, what do you do to protect your vascular system? Do you eat differently? Do you take a supplement? Do you do anything different, or you just live?
I just leave, and when I could, I exercised until I was 65. I played in a master tournament in water polo, but I played in all my
Wow.
life. So I was very active, skiing, everything, and I think that helped. And that's what I'm telling everybody to do exercise. And actually, I'm working also at the Hungarian, sports science university, and promote exercise wherever I can.
So I'm a little confused. I know you're, Semmelweis University in Hungary, Budapest, but aren't you at a university here too doing some work?
Yes, also at New York Medical College in the last 35 years, I'm associated with them, and did a lot of studies in microcirculation. And actually, we did this study with the glycocalyx with my colleagues. And so it was, I'm very lucky to have this position and then combine the knowledge, whatever I can learn.
That's great. You're going to make the cardiologist that works here very happy. The one that always talks to me about the glycocalyx.
Yes, it's a
Are there
beautiful
any other
subject.
are there any other nutraceuticals that you might think, just off the top of your head, might be a benefit in this syndrome that you can think of?
No, no,
Nothing.
I'm not.
Okay,
I don't have too much knowledge on that.
that's all right. Okay, any closing comments? Because this is very, very good.
My closing comments would be that let's let the expert come together and see the benefits and the risk of any intervention when you do it. And that's actually going on in most of the medical societies. They are writing up guidelines, and they rewrite the guidelines every 2 3 years and improve based on the information and data gathered within these 3 4 years. And I think that should be done, and I think it's already done for the COVID vaccine. Would be more patient specific or age specific or gender specific, regarding the application. Not just give it to everyone. You have to
Well,
see the
so
disease.
let me ask you this: who would you give it to? I don't see any upside. So tell me who you would give a COVID vaccine to right now.
No, I'm sure that there are many, many experts in immunology and epidemiology, because we don't know exactly the data, the epidemiology. We don't know exactly who got the COVID, who got the vaccine. Some of them, those data are not that clear. But nevertheless, we have enough data now, and then we can use artificial intelligence, we can use expert. The Center of Disease Control also, give out lots of good, advice and guidelines. But many people, in the leading university, they have great expert. They should come together in a room, in a hotel, and then discuss it, the benefits and the risk, and leave it up to the experts.
Well, you're an expert, so are you going to get another vaccine or COVID vaccine, or did you ever?
No, probably I will not get. I got Pfizer, and I didn't get any side effect.
Just one shot or
No, I got
multiple?
2 shots, 2 shots,
Two shots. And
but I
uh,
didn't have any vaccine.
would you encourage your family members to get it?
I mean, for older people, in Hungary they use Sinopharm or the
Mhm.
Sputnik, which is different. And
That's different,
Sinopharm,
correct?
that's also a potential, vaccine, and people should discuss it. Why we don't use it more widely, you know?
So educate me on the Sinopharm and the Sputnik. Is that those don't use mRNA technology, do they? Or
The Sinopharm, no, it's a virus.
right, correct.
And,
Okay,
but
and
it does
so
it does increases the IgG, but not as much.
right.
Not as, but it still may elicit other immunological response, not just IgG, but also cellular,
Right. So, but the
activation.
Sinopharm isn't making spike protein raging in the bodies of anybody.
No, it does not.
Right. How about the Sputnik?
The
So,
Sputnik is also less, not as strong as the Pfizer. And then I think with the Sputnik, there was a nice paper in the Lancet where they measured the IgG, they measured the cellular response. Was I think it's a good paper.
right, but it wasn't a messenger RNA derived
No, it's
vaccine.
not. It's
Correct.
not
All right.
messenger
So,
RNA. No.
so both China, you're talking the Sinovirus, correct?
Sinopharm,
And
yeah.
the
Russia,
Soviet
they had
Union.
a different approach, and then some people who couldn't get the Pfizer, they got those one. So it will be interesting to see if there is a post-vaccination syndrome with Sinopharm or with the Sputnik, and then we
Well,
could learn from that.
yeah, absolutely. I mean, it'd be simple to do if I mean they're not having increased vascular events or whatever. I mean, you could measure the spike protein antibodies in them to see if I mean,
You know,
but they
I,
wouldn't have them.
I didn't hear, too much about the post-vaccination syndrome with Sinopharm or with the Sputnik, but maybe there are, people, maybe focusing too much on mRNA, which is actually a revolutionary technique, and I'm sure in the future we will gonna use it for something. When we discover something, we will gonna use it. The humans
Yeah, we've
like,
wanted we've wanted to use it for a long time.
yeah,
Well, what you said, I mean, truthfully, I've thought that, but what you said just at the end, the fact that two major powers in the world didn't use the messenger RNA technology, not to mention it happened to be the West's adversaries, but that's
so
you
some
know
people should research on that. Do
yeah,
research, what was the morbidity, what was the mortality, whether there was a side effect, what was the side effect. I didn't see too much in the literature.
right. Okay. Anything else you'd like to say before we close? This has been
No,
great.
thank
And
you.
I'm so glad we got all the mechanics working so we could talk.
Yes,
And
yes. We
and
have
I'll
to
put
be
them all,
open. That's the most important. We have to be open.
so we'll be in touch. All
Okay.
right. So I want to
Thank
thank
you,
you.
Kirk.
I want to thank you, the audience, for listening to this edition of the Staying Healthy Today show. Until next time, stay and be well.